So here I am again, and a little late today. So for those of you who are used to seeing me early in the morning, I'm sorry. We have a course going on here at the Chopra Center for Wellbeing. It's our journey into healing for healthcare providers and doctors and just about everybody who's interested in improving their health. This course has been offered through UCSD Medical School for CME credits, and today I have the good fortune of having two visitors, David, and Dr. Morris, right?
Yes.
And I'm going to talk about what is happening in Palm Springs with the Desert AIDS Project. And therefore, I'm not answering your question today at info@chayo.com, but I do want to remind you that you can send any questions to info@chayo.com. They're placed in a queue, and I respond as and when I respond in the order that I receive these questions. So, David Brinkman, you and I have kind of had interactions for several years, right?
Yes, I've been coming to the Chopra Center for several years.
So tell us about first how you involved with the Desert AIDS Project. What is it? How long has it been going on? And what is happening?
Okay, so for the last 33 years, Desert AIDS Project has been serving people living with HIV and AIDS in the Coachella Valley, which is Palm Springs, California. We're a charitable healthcare organization, and not dissimilar to Dr. Chopra, we use a holistic approach to care for our patients. At the end of the day, we want to see our patients thrive, we want to see them happy, and we want them to actualize a happy and successful life.
And how many people are part of this program?
So right now we're caring for about 4,200 patients. There's 600 of us that are volunteers and 200 employees.
And besides treating patients with a holistic approach, which includes yoga and meditation, what kind of research have you been doing, looking at CD4 levels and viral load? What's the experience in general?
You know, we are very fortunate today that Western medicine allows us to keep people alive for their normal life expectancy. And a really important part of President Obama's legacy is the Obama Healthcare, the Affordable Care Act. And through that, low-income Americans, which oftentimes people with HIV are low-income because they become disabled by the disease, have access to what we call Medicaid, or in California, Medi-Cal. Every 90 days, as they see their physicians under the leadership of Dr. Morris, we measure their viral load and their CD4 count. So we're looking at their immune system, and we're looking at our ability to suppress the amount of HIV virus in their body.
What kind of results are you seeing?
We can, as I shared, keep people alive for their normal life expectancy, but that doesn't mean you have quality of life. And that's where we bring in our holistic approach to providing health care. We look at everything from behavioral health to how housing affects healthcare, nutrition, case management, acupuncture, Reiki, meditation, yoga. And we find when we treat the whole person, acknowledge the whole person, that we are able to have better health outcomes. Because living with HIV, you have permanent increased inflammation in the body.
And you were mentioning to me that there's a lot of people suffering from depression as a result of this chronic low-grade inflammation, right?
Yeah, that it goes side by side. Depression with HIV, about 75% of our patients are suffering from depression.
75%?
Yeah.
Wow. Which in itself then aggravates the inflammatory process. Dr. Morris,
Yes.
You were in Atlanta before you came to Palm Springs, right?
Yes, I was in a private practice, and before that a community health center, federally qualified center. So I've actually been
You're
treating...
an AIDS specialist, right?
I'm an AIDS specialist. I'm a certified HIV specialist for 17 years.
Why did you move to Palm Springs?
So a year and 9 months ago, I moved there, and I chose it in particular over other places that I was looking to move to California, because I saw the cohesiveness and the integrated care and the full panel of healthcare, unlike other places I've ever worked before. Two other things.
What would happen if we, first of all, I personally want to express my gratitude to Congress, both Republicans and Democrats, who have kind of blocked the repeal and replace, because that would affect people who are suffering on a massive scale. Let's say we did have repeal and replace. How would that affect the patient population that you're speaking of?
So I have patients daily that come to me, and they'll say, Dr. Morris, I don't know what we're going to do. If we have this insurance dropped, we're going to go back to the days where we couldn't afford medications when there weren't medications, and we're going to develop AIDS again. It's not just going to be HIV. We're going to have the full-blown AIDS within 6 months or 1 year. So they're very anxious and depressed and scared and worried that they could lose just basic health care for them, and it puts them in a huge vulnerable position when you do that.
In life-threatening situations.
And very life-threatening, yes.
David, you were saying that these patients, now have lived for decades. They've been through cycles where once in a while their life is threatened.
Yeah.
What do you think of what's happening right now?
The majority of our patients were diagnosed when they were in their early 20s at the beginning of the epidemic, and they were told by their physicians, be prepared, you'll have 18 months at the most left. And new medications came out, and so people were said, okay, you'll live for a few more years, and the drug companies, they were using our patients as guinea pigs to keep them alive and try new medications on them, and it worked. By and large, there was a lot of permanent damage to their organs and immune system because of it, but most people made it, or many made it, I should say. And to think that somebody in the White House would say to them, maybe you won't. Maybe you won't live your whole life expectancy after all, because maybe we're going to save a little money by cutting your medications or programs such as Desert AIDS Project. It's cruel and unthinkable what it would do to somebody's psyche to hear that after they've been told they're going to live their whole life expectancy.
So all of you who are watching this, don't let that happen, okay? Speak to your congressman, speak to your local representative, and don't be a bystander. Don't be passive and allow the suffering of humanity be at the whims of politicians who have only their self-interest. I also want to introduce you today to Dr. Sheila Patel, who is here. Dr. Patel is the director of the mind-body practice here at the Chopra Center. Sheila, introduce yourself and tell us the role of the microbiome in the whole inflammatory vicious cycle of inflammation which affects both mind and body, and what we can do about it.
So I'm Dr. Sheila Patel. I am the medical director here at the center, and the medical component, which is Mind Body Medical Group. We have several physicians, and we do integrative medical consultations based on the principles of natural healing that come from the traditional healing system known as Ayurveda. And we take these general principles of natural healing and integrate that into every patient that we see, and try to figure out from a mind, body, spirit approach, looking at the whole mind, body as a system, and everything that happens within that system is interconnected. What are the factors that are going to best help that patient? And we look at them as individuals and give them any number of personalized prescription for healthcare. And one of the main factors in what we're finding in the science, as well as Ayurveda had said in a different language, is the state of the digestion. And although they used different terms thousands of years ago, we really are finding validation with what we're finding scientifically with what we would call the microbiome, or all the natural bacteria and their genes that exist in our intestinal system. And there are many ways that we can keep that in balance. When that part of our system is not in balance, that can create this low-grade inflammation that's at the root of pretty much every chronic illness, including mental illness, physical disease. So when we eat healthy, whole food, plant-based diet, use healthy spices, and Ayurveda gives us lots of recommendations for how to eat. And when we're keeping our emotions regulated and through the neurological system, keeping the intestines balanced, then that's a big part of a natural healing approach to really pretty much any health condition. So,
Sheila, what can we offer to the Desert AIDS project?
well, first of all, what they've created is just an amazing place of truly where all of healthcare should be, is an integrative approach where you're using the best of modern medicine to help people thrive and heal, but also integrating natural healing methods, of which David and had described that they do. So I would love to see that as the foundation for the way we treat every patient. And we're hoping to do some research projects with them and planning to look at some of these very inexpensive natural healing techniques, including some herbs that can shift the microbiome and how that can improve some of the intestinal health, which some of those health conditions do specifically affect the AIDS population. And what can we do that would come from these natural healing methods, using natural anti-inflammatories and rebalancing the body to reduce inflammation in the body, using inflammatory markers, and looking at general measurements of well-being. So we're really excited to start some research projects.
So I would also like to tell you about some of the research we're doing here and at the Chopra Center for Wellbeing. You can of course go anytime to choprafoundation.org and click on research, and you'll find a lot of research on epigenetics and gene expression, inflammatory markers, etc. And it so happens that our director of research, Dr. Paul Mills, who's a professor at UCSD Medical School, is also here, and we just finished lunch together. And Paul, you had some very interesting suggestions on what measurable things we can do, measurable outcomes, including how to measure and correlate inflammatory markers with psychological evaluation, depression, etc. So please tell us what our plans are now.
Sure, happy to. So hello. Here at the Chopra Foundation and the Chopra Center, we have a very robust research program advocating essentially whole systems medicine, of which Ayurveda is a long-standing tradition. And at UC San Diego, we have a Center for Integrative Medicine, which is really devoted to advancing our understanding of what whole systems medicine is. And whole systems medicine really has been inspired by the Ayurvedic system and Tibetan system. For this particular project, I really very much enjoyed our lunch together, and we had a lot of ideas. And I want to begin to use the resources we have at UC San Diego to advance our understanding of the value of this whole systems program at your center. And specifically, one of the things we spoke about is to simply start gathering blood samples from all the patients coming through to monitor their inflammation, and then to link dynamic changes in that inflammation level with all the different integrated modalities they're receiving. And we would also tie that into, let's say, a panel of psychosocial questionnaires around depression, anxiety, stress, a sense of spirituality, and to just demonstrate how true health care really needs to be integrative when we're addressing the entirety of the person, the mind, body, spirit, and importantly, the environment of all the individuals at the centers, the staff and the physicians and the other patients there. So that's our goal at this point. We're just launching our discussion, and we'll have more ideas as time moves forward.
Paul, thanks for very much. And now, you've been sending me emails to info@jayo.com, and please do. I'll be answering your questions. But before we finish this program, this podcast, I want to introduce you to the CEO of Jayo.com and how Jayo is involved in let me figure this out. How is Jayo involved? Okay. Shall we? How is Jayo involved? No, we have to turn it around.
No.
How is Jayo involved? So who you're looking at right now is the CEO and co-founder with me of Jayo.com. First of all, whenever you see something on Jayo.com or Jayo for Life, YouTube channel here, the person behind the scenes is Punacha Machaya. So Punacha, tell us about Jayo in general, and then how Jayo is going to be involved along with the Chopra Center and the foundation in this project.
So I think, Deepak, your vision was to reach 1 billion people, to create a joyful, energetic body, a loving, compassionate heart, a restful but alert mind, and lightness of being. So Jayo is a well-being platform which looks at the 10 areas of well-being, which is intention, mind-body connection, nutrition, movement, sleep, love and relationships, eliminating toxicity, creativity, career and finance. So our goal is to really bring in the 10 aspects of well-being to really bring healing. In that particular area, we want to work very closely with David Brinkman and Dr. Morris to provide Jayo as a platform for their caregivers to really bring about what we call behavior change, tiny habits. And the second aspect of it is to really augment, they are doing an amazing program anyway, but to bring in this concept of well-being zones, we want to bring in some new technology, which is grounding, so basically reduce inflammation when patients are undergoing treatment. And the second thing may be looking at technology as a tool to help people meditate, looking at brainwave entrainment, which is photoic stimulation and binaural beats. But end of the day, I was basically, once I met them, it was an amazing place, and I think we will collaborate and do a lot of things together.
So how can people use Jayo right now?
So just go to Jayo.com, J-I-Y-O, download it, and basically get tiny habits and nudges to help you in your well-being in the 5 areas: nourish, move, love, meditate, sleep. And
once again, what's the website?
J-I-Y-O. Thank you, Deepak.
Oh, okay. And also these podcasts that we're doing,
Right.
they can, there's a YouTube.
Yeah, YouTube, Jayo for Life. Our goal was that Deepak has tremendous information he shares every day. And our goal was to archive everything, put into a repository. It's called Jayo for Life on YouTube. And down the road, our goal is to really make it interactive conversation. Like you say, Alexa, help me about inflammation, and hopefully Jayo for Life will give you a video. Alexa, talk about AIDS and inflammation. It'll bring about this conversation. So our goal is to make the entire conversation seamless.
People are saying they still don't get the spelling.
J for Jack, I for India, Y for Yak, O for Orange. JIYO.com.
Okay. So I think that's a lot of information for today. I'll see you tomorrow. Keep your feet on the ground and keep reaching for the stars.
Very good.